Hi, I'm Tom Wynn. I am the Vice President of the Inflammation Immunology Research Unit at Pfizer. And prior to joining Pfizer in 2017, I worked at the National Institutes of Health for several years. I was invited to give the keynote talk at the Keystone meetings, the joint Keystone meetings on stromal cell biology and fibrosis in February of 2026, which will be held in Banff, Canada. Yeah, so I've worked in the field of fibrosis for virtually my entire career from postdoc. Of course, my background or my research focus has expanded since I joined Pfizer, but I've had a long-standing interest in fibrosis. And my unique angle on fibrosis, I think when I came into this field in the early 90s, was I was coming at it from an immunological perspective. At the time in the early 90s, when you went to a meeting where fibrosis was a big topic, a big part of the focus of the meeting was almost always on the fibroblasts and the function of the fibroblasts. There was much less going on in terms of how the immune system and other cell types actually impact the activation of fibroblasts. So my unique angle was the immunology of fibrosis. And so I'm sort of hoping to cover in my talk, my keynote talk, how immunology has influenced our understanding of fibrosis and stromal cell biology more generally, and more recently, how it might be impacting drug development. Yeah, I think there's really obvious synergy between these meetings, and I think actually attendees at the meeting are going to have a tough time deciding which of the two meetings to attend. And there are a couple joint sessions, which is great. But stromal cell biology and fibrosis are very intimately linked. Of course, the key cell in fibrosis is the fibroblast. It's a stromal cell. I think in the fibrosis meeting, you'll see a lot more on mechanisms that are involved in the activation of fibroblasts to lead to wound repair and fibrosis. And then in the stromal cell biology sessions, you'll likely see a little bit more beyond fibrosis. One of the exciting things that's happening over the past several years with omics technologies is that we're learning a lot more about what the fibroblast does besides just wound repair. We're learning that they're inflammatory cells, they're sentinel cells in the tissues. So I think there'll be a lot of interesting overlap between the two meetings, but very different content of how that information is being applied to the understanding of disease more generally. I think what's happening now, and it's not that new, but I think the technologies are getting better and better, and more people have access to it now. It's all the omics technologies, so transcriptomics, proteomics, et cetera. And I think the latest exciting thing is spatial information, and how we're not only understanding the cells that are involved in disease, how they're activated, their expression profiles, et cetera, but we're also learning through spatial technologies in disease tissues where those cells are located, who they're communicating to, and this is providing really important insights on key cell types that we might go after to treat those diseases because we're understanding how they're interacting. And I think you'll see a lot of that at both of these meetings. I think the thing that I'm most excited to hear about, and there's a lot going on in terms of translation of the basic science that we've learned at this meeting over the years into therapeutics. And this has been a long time coming. There's only a few medicines in the fibrosis field in particular that have been approved. Those medicines have been approved nearly a decade ago, so we're making some progress with the treatment of fibrotic diseases. But there's a lot going on in the clinic now with phase 1, phase 2 clinical studies, and some phase 3 studies. So it'll be exciting to see what's going on in terms of clinical development in this area as well, and you'll also learn that at this meeting. So you always feel like you're at the cutting edge when you're attending a Keystone meeting, and it's just a great opportunity to network with your colleagues. You get good people, good speakers, good short talks selected from the abstracts. The networking at the poster sessions is fantastic. So it's just so many opportunities to do networking and potentially build collaborations, which this has been one of the key meetings where I've done that.